Premenstrual syndrome Yegijanova Gulbashan Mirzahmetovna. Premenstrual syndrome (PMS) is characterized by irritability, anxiety, emotional lability, depression, swelling, pain in the mammary glands, headaches that occur 7-10 days before menstruation and usually end a few hours before the onset of menstruation. The diagnosis is made clinically, often based on symptoms daily recorded by the patient herself. Treatment is symptomatic and includes diet, medication, and counseling. The cause of PMS has not been elucidated. The cause of PMS has not been elucidated. Possible causes and related factors include many endocrine factors, example, hypoglycemia, other changes in carbohydrate metabolism, hyperprolactinemia, fluctuations in the levels of circulating estrogen and progesterone, an abnormal response to estrogen and progesterone, an excess of aldosterone and antidiuretic hormone, ADH, genetic predisposition, serotonin deficiency, possible deficiency of magnesium and calcium. The most common symptoms are irritability, anxiety, restlessness, anger, insomnia, difficulty concentrating, lethargy, depression and severe fatigue. Fluid retention leads to edema, a temporary increase in body weight, engorgement and tenderness of the mammary glands. Severity and a feeling of pressure in the lower abdomen and back may be observed. In some women, especially young women, dysmenorrhea occurs with the onset of menstruation. Also, a certain combination of symptoms should be observed during most of the last 12 months, and the symptoms themselves should be expressed so as to disrupt daily activity and activity. Other non-specific symptoms may include headache, dizziness, paresthesia of the extremities, fainting, palpitations, constipations, nausea, vomiting, and changes in appetite. Acne and manifestations of neurodermatitis may also appear. The course of existing skin disease, respiratory disorders, for example allergies, infectious, and eye disease, for example visual impairment, conjunctivitis, may worsen. PMS is diagnosed based on physical symptoms: bloating, tenderness of the mammary glands, pastiness of the arms and legs. A woman may be asked to record symptoms daily. Physical examination and laboratory tests are not informative. At least one of the following symptoms is required: noticeable mood swings, example, sudden sadness, severe irritability or anger or aggravation of interpersonal conflicts. Observe a depressed mood, a sense of hopelessness, or self-deprecating thoughts, severe anxiety, tension, or nervousness. In addition, one of the following symptoms should be present: decreased interest in normal activities, which can lead to complete alienation, difficulty concentrating, weakness or fatigue, noticeable changes in appetite, overeating or craving for a certain food, insomnia or hyperinsomnia, feeling depressed or losing control. Physical symptoms associated with PMS, example, breast tenderness, edema. Thank you.